My name is Eleanor Zacharia. The purpose of this voiceover PowerPoint is to explore my strengths and weaknesses, my interests, explain my academic path, such as where I began, where I am now, and where I plan to take my future, the resources I need to pursue my future goals, and my plan to continue lifelong learning in my professional practice. Where I began. Upon graduating high school, I wanted to attend medical school. In high school, I fell in love with biology my sophomore year. This was a turning point for me. I started to get serious about my education. I continued to pursue the science world until I reached college. I went to Buffalo State for a bachelor's degree in biology and a minor in chemistry. After 2 years, I realized that the program was not a correct fit for me and my interests. I am interested in biology, but in the human aspect, which I was getting very little of. I transferred to Trocaire College based on a recommendation from a friend, where I took anatomy and physiology my first semester. I aced the course, and I thoroughly enjoyed this class. It was right up my alley and aligned with my interest in the human body. I knew right there I had found my niche. I entered the nursing program, which I completed, making the dean's list every semester but one of them. Nursing was my talent, it was my passion, and something I worked day in and day out to perfect. I graduated with distinction in December of 2017. I completed over 3,000 NCLEX questions in preparation from the time I graduated to the date of my exam. After 45 minutes and 75 questions, I passed my boards in February of 2018. Where I am now. I accepted a part-time night shift nursing position at Mercy Hospital of Buffalo on 6 McCauley East, a post-op, medical surgical telemetry unit. I had been employed at Mercy for the last year and a half on a different med-surg telemetry floor, and then later in their emergency room as an immediate treatment assistant. Before I finished orientation, a full-time position had opened up on my floor. I applied for it, and I was offered the position the following week. I'm now a full-time registered nurse on this floor while attending University at Buffalo for my BSN full-time. I was released from orientation early because I was doing so well, and I've been on my own for about a month now. Where I want to go. During nursing school, I realized I had a passion for critical care. It was my third semester during a lecture about shock when my eyes were glued to my professor because I was so intrigued and interested in the lesson. I loved everything about shock, so much that when the lecture ended, I sat up in the library for hours until my shift at the hospital started to study the material. It stuck instantly, and I decided I wanted to pursue a career in emergency medicine and critical care. I searched my hospital for a position in the emergency room as an aide. I applied for one, and it was offered to me a few weeks later. I was eager to start. I dropped my CPR card off the day I was hired so that I would be able to help in codes. I wanted to pursue my nursing career in the emergency room, too. However, I have to complete 1 year of med-surg experience prior. I will return to the emergency room once my 1 year is complete on my current floor. I am working on my BSN with plans to begin the Doctorate of Nursing Practice program the week after I graduate in May of 2019. I want to become a family nurse practitioner in trauma or emergency medicine. I would ultimately like to work in a trauma intensive care unit. How I will get there. In order for me to get back to the emergency room, I will build up my experience on the floor I work currently. Once I feel I am ready, I will apply for a position and reach out to the managers since we have already established a relationship. They are also aware that I want to come back and are hoping that I do. To get into the Doctorate of Nursing program, there are certain academic requirements. I met with Louisa Case prior to the beginning of this BSN program to have my questions answered. She introduced me to the early assurance option for UB students, where a higher GPA is required, but there isn't a GRE requirement. I have mentally decided that this is my plan. To keep my GPA above a 3.5, I check the rubric for each assignment to look at what needs to be done in order to get the maximum amount of credit. Some courses require a response of 2 to 3 students instead of 2 for maximum credit, which requires me to go beyond the minimum. I check my course grades very frequently to see where I am at and what I need to do to get myself to where I should be. I also use the GPA calculator quite frequently to make sure I keep myself higher than a 3.5. On my floor that I work on currently, my manager had said upon hire that I will have the opportunity to be trained and be the charge nurse on some of my shifts. To me, this was an important factor that led me to accept the position on this floor. To have the opportunity to be a leader and take on this role as charge nurse is essential for my growth and development as a nurse and later a nurse practitioner. What are my strengths and weaknesses? I would say I am strong when it comes to understanding how the human body works. I am able to learn information quickly and understand and remember. A lot of this is due to the strong interest I have in this area. I am also not only strong academically, I am strong with my bedside manner. I am very emotionally intelligent and able to empathize with patients and their families. I have no issues with listening to my patients' concerns and doing what I can to put them at ease. In fact, I have had patients commend me on this and thank me for being so good at what I do. A weakness of mine is definitely taking criticism or being corrected when I am wrong. Since I am such a perfectionist and so tough on myself, I take criticism to heart. I do not have thick skin, which is sometimes necessary in the medical field. If a doctor or a coworker speaks to me negatively, it impacts me a lot because I allow it to. I will often dwell on a situation for way longer than I need to. These are certainly features of mine that I am aware of that need to be worked on. How will I use lifelong learning? I believe my goals that I have for my nursing career clearly demonstrate my desire to pursue lifelong learning. I will be using this to further my education and climb the ladder in the nursing field until I get where I want to be. I am a very goal-oriented person and very passionate about my career, and I plan to continue to learn in this field until the day I retire. I will always need to keep learning in order to adapt to the revolving medical world. Even once I reach my goal of being a nurse practitioner, I will always attend classes, study new practices, new medications, and new diseases in order to best serve my patients and be sure to diagnose and treat as accurately as possible. Lifelong learning is absolutely essential, especially in medicine, because it changes so rapidly. New medications are always being created and new diseases are always surfacing. What will it be like when I get there? When I achieve all of my goals I have for my career, it will be personally fulfilling. I have achieved all I have wanted to up to this point. As I continue to pursue my goals, I become more confident in myself and can see myself transforming and growing into a strong healthcare provider. It has been a dream of mine for many years to diagnose and treat patients. It is a passion of mine and I love the process of getting there. I have started from the bottom and I continue to work my way up until I get to where I want to be and where I am satisfied. Once I get to the end game, I will feel like I am on top of the world and I will be doing what I love. This is the thought and feeling that keeps me motivated and focused on my path. I will not stop pushing for and pursuing my goals until I get to where I want to be.